everyone, welcome to Political Capital. Thanks so much for joining us for another week. We've got many different topics here. BC politics never fails to disappoint, including in this pandemic where it seems like every week everything changes. But thankfully, we've got a great panel to bring you up to date with all the latest news, analysis, everything you need to know about BC politics. Remember, you may be watching us on Czech Television at 6:30 on Sundays. We have an extended format for our podcast. Make sure you subscribe. All the platforms, the Googs, the Trons, the Tubes, Chugi. I don't even know what that is, but you should subscribe to it because our podcast is probably on it. And we'll have more content for you there that you are welcome to consume in your ear holes at your leisure. Let's get to the panel this week. We have Jillian Oliver from the Greens, who is off this week, taking care of some health issues, and we wish Jillian well. I'm sure she's going to be back next week to join us. So Maclean K from the Orca is here as usual. Hello, Maclean.
Hello, Rob.
And Katy Merrifield, Vice President of Wellington Advocacy. Hello, Katy.
Hey, Rob. Happy to be here.
Thank you both for being here. Let's start with a topic that really kind of percolated throughout the week, the embarrassing, confusing statements by the National Advisory Committee on Immunization, NACI, earlier this week, coming out and giving advice to people that kind of contradicted its previous advice, saying that the Pfizer and Moderna vaccines are the preferred choice for Canadians, and they should weigh the risk of taking AstraZeneca and Johnson & Johnson because of the very, 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 very small possibility of blood clots. It left this impression there's some sort of hidden hierarchy to the best vaccines, and it didn't really match up with that what we've been hearing for a while now about the best vaccine is the first vaccine available to you. It seemed like just a gong show that never really got clarified, left a lot of people upset. Katy, what did you make of watching that kind of roll out over a series of days?
Yeah, Rob. So I think you're absolutely correct with the hierarchy challenge. Let's start with the problem here. The message to only get an AZ or J&J shot if you can't wait for Pfizer or Moderna really creates a two-tiered vaccine elitism. It affords people who can work from home the option for waiting for this alleged gold standard vaccine. And while those who can't are told that they need to get the AZ and J&J, which NACI itself has alluded to having kind of a level of unacceptable risk. This is not a good public narrative, speaking the obvious. It fosters vaccine hesitancy, buyer's remorse, resentment. I think the solution going forward, like what I was thinking about when I saw this roll out, is that policy experts should provide strategic advice to officials behind closed doors where these necessary frank discussions can be had. And it's the politicians and professional communicators that should speak to the public, full stop. Like these doctors, nurses, other vaccine experts at NACI are obviously highly, highly intelligent, very well-meaning, but they're not trained in public communications. And this debacle is really the reason that political staff need oversight on what is being said, especially with an issue as crucial as this. I thought back to years ago when the former Harper administration was accused of muzzling scientists. Well, this is why. This is why you have political folks have oversight on what is being communicated on a mass level. So those were my initial thoughts watching this debacle.
Yeah, it's an interesting point, and it didn't get any better. There was a series of attempts by the chairperson of NACI, who's a doctor, to try and come out and clarify this. Simply just made it worse. I think at one point she said on CTV's Power, I think Power and Politics or Political Power, if, for instance, my sister got the AstraZeneca vaccine and died of thrombosis when I know it could have been prevented, and she's not in a high-risk area, I'm not sure I could live with it. And I just thought, man, what a stupid thing to say. This idea that, A, raising the prospect someone's going to die, and B, that unless you really absolutely have to take AstraZeneca, you shouldn't be doing it, which is contrary to everything that the health officials continue to say. Maclean, what did you think?
Yeah, every time that there was an attempt at clarification, it almost got worse. And there's an attempt there to say two things that are not quite true. And one is that all the vaccines are the same, and you should take the first one offered. But if you can wait, pick this one. And so they're both equal, but one has an asterisk or something. I don't get it. The thing that is more galling, though, is that in the previous weeks, when they were rolling out AstraZeneca on an age-based level, based on your age, there was no provision for if you can or cannot wait. I got the AstraZeneca vaccine. And when I was given it at the pharmacy, there was no, the pharmacist did not say, well, if you're working from home, do you really need this? It's that if you can wait, maybe you should. Nothing that. I learned it was AstraZeneca as I rolled up my sleeve. So there was no time for an informed decision. And yes, I do work from home. And I was happy to get the AstraZeneca, but if that was the case, and we should be prioritizing people who cannot wait, then we should have prioritized people who cannot wait.
Right.
And that didn't happen. So there's a failure here somewhere.
Well, yeah, and the way that we rolled out AstraZeneca was safety concerns were raised about blood clots. We were stuck with a whole bunch of supply that was expiring, and government chose to jettison it out the space lock via pharmacies for people 40 plus, and everyone ran out, and it became a hot commodity suddenly, and including, I mean, lots of people got it, including noted Canadian hero myself, who also wandered out and got this, putting at risk this show, which I didn't think about at the time.
There you go.
That's right.
But you sort of feel like, Katie, and maybe you can pick up on this, but you sort of feel like it made some people, distrust what they were hearing from government and undermine the credibility, which is a very precious thing that is in short supply these days of some of our top health officials.
Quite frankly, I wish we didn't know the names of these vaccines. Like when you go to get a normal flu shot, do you ask who the manufacturer was and what the efficacy is compared to other manufacturers? No, you just get the shot. So this has created this situation where we're all kind of self-appointed experts on the efficacy of various vaccines. We are not capable of measuring that. And so at my core, I just kind of wish that we didn't know these names and we just sat in the chair, rolled up our sleeve, and got the shot.
Well, I mean, it brings up our next topic, which is what we know and what we don't know, and what we should and shouldn't know, and that is a leak to the Vancouver Sun this week outlined a very lengthy internal presentation that goes out behind closed doors from the BC Centre of Disease Control every week, which has a ton of data in it that is the same type of data that some people are asking for. Academics, journalists, researchers, some people in the public, they want to see a breakdown of what the COVID case counts are in neighborhoods, what's the transmission level at a very local level. And we've been hearing for almost a year now from the government that it can't, won't, and doesn't want to provide this data. Actually, it was mostly about how it can't do it. And suddenly we discover not only does it have it, but it's presenting it to itself every week behind closed doors. And that raised some questions about what we do and don't get and why we do and don't get things. Katie, why don't we start with you? Because you have been in a premier's office in Alberta under Jason Kenney at the start of this pandemic. You wrestle with the issues of what the public needs to know. Dumping all of our COVID data on people may not help our cause in any way without context and explanation and understanding. But what do you make of what has now come out here and what people should be thinking about?
Yeah, so on this topic, I was thinking to myself, I was like, okay, well, is it plausible to adopt the argument from the segment that we just discussed that government is only releasing data that is useful or digestible for public consumption? But that's not accurate, because BC has consistently failed to disclose the level of COVID data that other comparative Canadian provinces have. Like Ontario and Alberta publish far more granular detail, like neighborhood level case vaccine data. Alberta includes things like comorbidities, age, gender, vaccine adverse effects. In fact, Dr. Hinshaw and her team published some of the best data sets in the world. So I think what's most frustrating to me is, and probably media and others in the public as well, is this government has consistently said that they are being open and transparent, and now we know objectively that that's not the case because their own experts at CDC have revealed so. In terms of my experience in Alberta, Premier Kenney was very adamant from day one that we were going to publish all relevant data in as close to real time as possible, so that folks they could make informed decisions, and they knew what was happening in the province in various communities and could govern themselves accordingly. And so I can tell you, he personally suggested even more data sets that we could publish in order to be as transparent as possible.
You know, Maclean, our premier, keeps talking about us being the most transparent jurisdiction in the world, which is objectively incorrect and wrong. But what does this release do to both that argument and and the larger issue of whether we even need this, even though we want it, I guess?
Yeah, I mean, to the first point, there's a disconnect there. And that, Dr. Bonnie Henry has on occasion been asked about, not releasing certain sets of information and has usually had, an answer that you can agree or disagree with. But I mean, there was a rationale given. But the problem is the political side, it was exactly as you say, an insistence that BC was as open and as transparent as any other jurisdiction, which, again, as you say, is manifestly not true. I think we knew that before. It wasn't too hard to compare with the information that was available in places like Ontario and Alberta with what we get here. Now it's been completely blown out of the water, and so the NDP government is going to endure some criticism here, and frankly, it's well deserved in this case. Whether we need the information, that's a great question. Having more information has obviously not helped in Alberta and Ontario, but I don't think that's an argument to withhold it. I think that having more information is better. I do. There were some very good arguments early on about not wanting to stigmatize certain communities, especially as some First Nations were in the grips of an outbreak, and so you have some of these considerations do have to come into play. Again, there's an argument to be made there. At this point in the pandemic, I do think that I would lean on the side of releasing more information. But that said, the problem here is not going to be that decision that was made. It's going to be the disconnect between what the health authorities have said and what the Premier's office is saying.
And backing down now to provide a number of things that the argument was couldn't be provided. And one of you mentioned some of the excuses governments used over the years. It started with, we can't provide local neighborhood postal code data because it might identify people with COVID in small communities, which I didn't follow that argument very far. But then the next one was, yes, there are some First Nations communities, including the Cowichan tribes, that dealt with racism and racist blowback when they were having outbreaks. And so is it, should we be identifying those communities and stigmatizing them, which, okay, fine, but we're through that now because most First Nations communities were prioritized for immunization. So I'm not sure that argument is still there. And then there was the argument that really ticks me off, which is if you ask for this and you push and ask, someone will eventually at government turn around and say, well, what do you want? Do you want a public health official who's saving lives to put down their life-saving instruments and work on your stupid media request for data? And it's this implication that it's kind of a base level government response that it can't walk and chew gum at the same time. It's unable with 40,000 civil servants to respond to a crisis and also give you information about it. And that if you push too hard, like this data was so difficult to gather and make available that Dr. Bonnie Henry herself would have to take time off making life-saving decisions to collate a Google spreadsheet document for you, which is nonsense because it's here.
Garbage.
It's here every week internally. That's what this shows us, that it would take nothing to the government actively takes this 43-page document every week and censors it down to 10 pages and releases it. And so it's taking more work to remove the data that they have than it is to actually gather it. And that blows up that kind of weird pressure that you get from, and I find that a bit offensive, but that's a little bit inside ball. That's what it's like talking to government, asking for things and getting told your question is the problem. And you kind of go,
do you want me to comment on your point you've just made, Rob, or do you want me to continue breathing oxygen?
That's right. Can't do both at the same time. Can't do both. Do you want me to die or do you want me to participate? I'm like, geez. And that part kind of bugs me, but I don't know in the large, here's the question I want to ask. There's an idea out there that if we had this neighborhood data in communities that are hard hit, people would be motivated, they would know, and they would buckle down and better follow the rules. And the counterpoint to that from Dr. Henry is, well, yes, but if we knew communities that aren't having any transmission, would that cause people there to be more relaxed and not follow the rules as closely and potentially spark outbreaks? I don't know if either of those are more or less true or they're mutually exclusive, but that's the debate over whether we should and shouldn't have this. And does it twig anything for you guys this week that debate might be changing based on this being leaked?
I mean, it's changing because the vaccination is speeding up. That's what's changing. The arguments that go into whether or not it would be helpful or harmful to have this information out. I think these are different questions now than they were 12 months ago. But I don't understand setting aside examples like very small communities when you'll be fingering an individual, or in cases with like a First Nations community next to a larger center. Those to me make sense, but I think that knowing that there's, the neighborhood next to me has a problem and this one doesn't, that is useful to me, not just on a selfish level, but also in a why. Is it luck? Is it the fact that, that neighborhood has a high percentage of people who work in this workplace, which had an outbreak, or is there something else at play? I mean, these are the kinds of things that we don't know what we don't know. And only with information are we going to figure some of this stuff out. And I think it's crucial because there is going to be another pandemic eventually. We need to learn all this stuff. We need to understand all this stuff so that we can make better decisions and see patterns that may not be apparent right now.
What do you think, Katy?
Yeah, I don't disagree with Maclean. Frankly, if there is a community that is hardest hit, and that is disclosed publicly, it allows community leaders in that neighborhood to rally. It allows government to devote any further supports, whether that's, if it's a community that requires more in-language materials or other forms of direct support. I think that outweighs the potential risk of people not taking this pandemic seriously. I think people in British Columbia do take this pretty seriously, and that is reflected in our numbers. Obviously, aside from that kind of core group that continues to float regulations and protest in the streets, I think British Columbians as a whole have proved that they care about this. They care about themselves, their families, their neighbors. They want this to be over. And we have that kind of community spirit that we would rally around each other to help if a community was hardest hit.
For sure. Let's do we're going to do a quick sort of teaser topic here that we're going to talk a lot more in the podcast about because we're running tight on time. But I just want to go quickly around and ask about the BC legislature striking an all-party committee to examine whether to continue to provide a per-vote public subsidy for political parties. This is a legacy of banning union and corporate donations, government subsidy for political parties. Just quickly, what do you think is going to happen here? And then we'll pick this up again in the podcast. Make sure you subscribe, and we'll talk some more about that. Katy?
Striking a committee filled with politicians who all directly benefit from a voter-funded subsidy while pretending that it's somehow impartial or analytical, to me, is patently ridiculous. The NDP have a majority on the committee. Instead of this smoke and mirrors exercise, just make a decision.
What do you think, Maclean?
I think the result may be tied to how the various parties are doing in fundraising wise. The BC Liberals are going to object to continuing the per vote subsidy. That's a given. But the NDP might look at the money that's being raised in the field and say, you know what, we're doing better. So we think that this is a chance to hamstring you. Now, that's assuming these patterns will stay permanently, and they never do. But that is something that could be a short-term consideration that might enter in a strategist's head.
Yeah. Well, we'll talk about the fundraising of the parties too, because we got some new numbers from Elections BC, and then put them into the perspective of what that might mean for the parties and what they're going to argue on this committee, which is open to the public, by the way, for submissions till May the 28th and a deadline of September, because the per vote subsidy expires at the end of this year. So we'll talk some more about that. I want to do a hot take before we end the show here on when we think restrictions will be lifted. May 25th is the kind of date to revisit this. Looking at what we're looking at, just quickly, give me your thoughts on, are we still aiming for May 25th? Could it be earlier? Could it be later? When do you think we're going to lift some of these restrictions, Maclean?
Later. All these dates have been later, and the case counts are still in the 500 to 600s. I think we're looking at June or July.
Okay. Katy?
I don't even want to hazard a guess because there's so much mixed messaging from every level of government. I will say what I'd love to see is something that Saskatchewan recently unveiled, which is a reopening plan with the list of restrictions that correlate with a particular percentage of immunity. Yeah. And I think that's smart. It provides hope and optimism, and I would love to see the BC government adopt that.
It's an interesting point because it was actually just a year ago around this time that BC the Premier had BC's restart plan that he announced, which did have multiple stages, metrics that you have to achieve to reopen and regather and certain things. We don't have that this time. As you pointed out, Saskatchewan does. Other provinces have kind of said, here's what we need to see to do certain things. And I don't really know why we don't have that, other than it doesn't seem like we really know what that threshold might be anymore. And we don't know how long people are going to be willing to submit to these rules without some type of relief, and that maybe that number in Bonnie Henry's head changes a little bit every now and again, so they don't want to put it down on paper. But it's a great point. Other provinces are lapping us here on the planning to get out of this, and we are not doing the same. Nonetheless, we got a lot more in the podcast coming up. If you're watching us on Mother's Day, happy Mother's Day to everyone. Happy Mother's Day to Jillian Merrifield, Katy's mother, who's our big fan, super fan. Happy Mother's Day to Patty Ann, Maclean's mother as well, and to my mother, Lori. So thank you for spending some of your Mother's Day here, or if you're listening to us, thanks for having us in your podcast feed. We'll be back next week with all the latest on BC politics news here on Political Capital. Thanks for watching.
More episodes of Political Capital are available at checknews.ca/podcasts or search Political Capital wherever you listen to podcasts.